Texture in breast implants is important because, number one, it lowers your capsule contracture rate, especially if the implant's placed above the muscle, but I think even so when it's placed below the muscle. Secondly, I think it reduces the risk of malposition, of the implant being someplace you don't want it to be, sitting too high, bottoming out over time, being too low, where the nipple sits high, or maybe every time the patient lies down, the breast implants sort of slide out to the side, what we call lateral slip. Those are all sort of malposition problems that I think can be significantly reduced by using texture. Definitely when we see patients who actually have chest wall abnormalities, they really have, the chest walls are quite different on one side to the other. The texture helps to control the implant in the position you want it to, so it stays there. Otherwise, if you have smooth implants, often the implants do completely different things on those two sides of the breast, and you end up with basically two different looking breasts, and we don't want that. You know, when you think about the textures between the implants, this is probably the most variable between the implants, and so texture is not just texture. I always say, which texture are you talking about? Where we have one company that has a very aggressive texture, there's another company that provides implants as a way less aggressive texture, maybe not enough in my mind in most patients. And then you have the Sientra texture, which falls right in between, has just that perfect balance of texture so that it holds the implant in place where we want it to. It lowers the capsule contraction rate, but it still has some mobility and it doesn't really attach to the tissue, which I think has some significant advantages long-term for the patient. When you place a textured implant, you do it a little bit differently than you do a smooth silicone implant. Because the implant doesn't move much, which is why I like it, I need to put the implant exactly where I want it to sit. That's not true with smooth. You can actually close up a breast pocket with a smooth implant. It can be sitting very high. Over time, because it's smooth, it will drop down into the bottom of the breast and sort of stretch it out. That doesn't happen with textured implants. You place it exactly where you want it and you expect it to stay there. And in that way, you have stability and control over the final results. If I put a smooth implant in, and it doesn't drop like I think it's going to, if gravity doesn't do what I think it's going to, or nature or anything else, I don't know exactly where it's ever gonna land. Sometimes it's perfect, but sometimes it never really drops that well and you end up with a high riding implant, and sometimes it drops too much and then you have a bottomed out breast. That's what I don't like. That's what I call lack of control in breast augmentation. So texture allows me to put the implant exactly where I want it and then have it stay there, and you get a much more stable, predictable result.